Hello everyone. There is a topic I want to talk about, but I've never had the chance during our presentation at the conference since there is a time limit for presentation or more important topics to cover. So this topic has always left uncovered. I don't know why, but our patients do not ask about this either. But this is always in my mind, so I wanted to make this video. We perform penis enlargement. We take fat from belly, sometimes from the inside parts of the legs, groin. So there is bruising on the area we took the fat from. This is what everyone asks for liposuction. Is there going to be bruises? They say no. Or if we do it with this machine, then no, etc. There is going to be bruising on penis enlargement. Why? Because we do not take any measures against it. Well, why is that so? Now, look, this video is for patients and also for surgeons who perform this surgery. I need to make this clear. Why there is bruising on belly where we took fat from. First of all, I want to say that this is not a liposuction surgery. It's not going to be burn your belly fat. The fat we take from belly is only 50-60 cc. So this is not going to make any difference. Normally, during liposuction, they inject a special medicine to the area. This stops bleeding after a while. If you perform liposuction after 10-12 minutes, this medicine, there will be no bleedings, just yellow fat tissue, no blood. But when we take fat from belly during penis enlargement, we purposely do not do that. Why? When you take fat from belly during penis enlargement, quality of the fat gives you so many clues. Sometimes this fat can be very dry. Nothing comes out. When you refine it, it looks like mashed potatoes or smashed banana. No water. When this kind of fat comes out of the patient, then it's going to be very permanent. I saw some cases after 5-6 years after the surgery, there was no dissolution. They can stay for years. We can predict this according to the quality of the fat. Sometimes I say to a patient after surgery, there will be no need for re-injection for you at least for a couple of years because the fat tissue has a good quality. It can stay there for years. However, sometimes fat can be very watery. It is just like water and the injector, and it's floating in the water. Even when we refine it and inject the solid parts, there will be plenty of loss. This solution is very high for these cases. And I want to stress this too. They always say 30% or 40% of the injected fat will stay. You cannot give the certain percentage like that at all because it depends on the quality of the fat that comes from the patient's belly. The solution percentage can be 0% or 50%. I am talking about the patient that I saw 60 years after their surgery. No dissolution, nothing has happened. Stays like a stone. In these cases, if we saw that the fat was dry, we say it to the patient and it becomes true later. I said the fat I took from you, fat was not very good. It was kind of watery. We expect high dissolution from this. Come back after 6 months or 1 year. A lot of it will dissolve, I think. He comes back later and say, you have told me. It really dissolves, so our foresights come out right. Why we don't take any measures against belly bruises? Why we do not inject medicine? That's important. Now, if you inject medicine to the belly in order to prevent the bruising and bleeding, this injected medicine will dilute and the fat and affect the quality of the fat. Fat tissue will be watery with injected medicine. That's why we do not inject anything to prevent it from misguiding us. We directly take fat from belly. The amount of fat we take is only 50-60 cc. They inject medicine to prevent embolism. There is something called fat embolism or perform liposuction with certain machines. Why don't we do this in these cases? Because there will be no embolism or anything for 50-60 cc. It's a very small amount. I have never saw or heard something like that. It's not going to make any difference for belly either. That's why we directly take fat from the belly without injecting any medicine to prevent it from misguiding us. When we directly take the fat tissue, we can observe the type and quality of the fat. That's why you don't need to inject any medicine to this patient. That's how I am thinking. Okay, there will be some bruising, but it's not permanent. It will heal in 10 or 12 days. But the quality of the fat shows us the benefit of the surgery. How will it perform and how long it will last? We understand it by the quality of the fat. That's why I don't recommend to inject any medicine. This is both a useful information for patient and informative thing for my doctor colleagues as well. Take fat directly without injecting anything, because if you inject any medicine, it will confuse you about the quality of the fat. Quality fat should be dry. Poor quality fat is watery. I'm going to make another video about the quality of a fat tissue. Please watch that video too. I will exemplify a very bad case and a very good case there. I generally do not upload patient photos or surgery tapes there, but this one will be very informative. I show these two cases on my seminars that I give at the university. I will upload them here for you to see as well. If fat is in high quality, it will last long, and if it is not, it will dissolve quickly. What should we do to do with the dissolved part? Let me say a patient who we took fat from his belly came back to us after 6 months with dissolving problem. We performed a second injection on this patient, but it cannot be done before 6 months. It has to be after 6 months or 1 year. Second fat injection generally lasts longer. I will talk about all of this on a separate video. I wanted to talk about bruising on belly here. The reason of it is that we don't take any measures against bleeding. Thank you for watching.